But what the real story is that the bed next door, there was a little boy who had asthma, and he had an attack one night, and he seized, and he stopped breathing. So the mother starts screaming, the resident comes in. Now, one thing you need to know is that a lot like the American hospitals, the Honduran hospital is the same. The residents really run the place at night. But there's a few rules, there's a few policies. And one of them is that residents are not allowed to perform heroics on patients without an attending being present. And the reason is because they only have 3 ventilator beds. So it's a scarce resource. So this particular night, I have, this child that's not breathing, a mother that's screaming, the resident comes in. I ran over and was positioning the patient, getting ready to do CPR, open the airway, do the intubation, the full Monty, and the resident grabs my arm and says, "No." And she turns to the mother in just as plain a face as anything and says, "I'm so sorry, your son has died." And I was like, what? We haven't even gotten started yet here. And it was then that it clicked. I realized there's no attending. I understood, but what I knew she didn't know is that this was a kid that was savable. And so I looked at the mother who was sobbing and the child who I needed to get some air to, and I said, "Look, we can do this. Just trust me, we can do this." I had been a university faculty employee. I had been working at Jordan, and I was promoted to the medical director position. I was in that position for about a month whenever I got called into the office, and I was told at that time that Jordan was going to close. They had had several years of financial difficulties and a lot of bad press, and it was time to close the doors. I tried to have a healthy debate about the fact that I felt things were getting better, and I was really told, this is in strict confidence and you're on a need-to-know basis only. So I walked out, and I felt devastated deep down because I knew my patients' needs. I had been working in the community, and Jordan is a really vital place for the community's health. I knew that without it, people's lives would be at risk, and I knew that there would be more suffering. So I really had to ponder what to do next, and I'm a true believer in where there's a will, there's a way, and I knew that the only way was for me to be able to speak up, even if it was unpopular and even if it meant that I lost my job at the university. So I went back, and I had a few days, I had about a week before the board meeting when it was going to be announced, and I rallied the staff at Jordan that I knew had the same feeling about our mission, and I spent 3 days and 3 nights writing a business plan. I didn't know anything about writing a business plan, and I didn't have access to the finances, so I really was piecemealing pieces together from what I could put together from asking questions and doing my research. And I knew that I would need a business plan if I was going to convince anybody that it was possible. Especially I needed to start with the staff, because as you know, once you find out that someplace is going to close, people start looking for a job. So that was my first priority, actually, was to really help the staff to understand that with their help, this was possible. Anything that you can do to conserve resources is going to help you to be more successful and to deliver the services that you need. So you really can't act alone. And just like a physician, a physician is great, I can write a prescription, but if I don't have all of the other pieces in place, my care plan will never get enacted by the patient. And so I learned early that the best remedy to that is to collaborate. And so at Jordan, that's one of the things I think that we've done so successfully, is we've actually brought in all kinds of different community partners to help us to meet the needs of the patients that we can't meet as just a healthcare center, just physicians, just nurses, medical staff. So one of the examples of that, I think one of our best collaborations has been with St. John Fisher, because we are helping with their residency training program, and in return they're helping our patients to understand their medicines and to basically maintain adherence to the physician treatment plan. And it's been great because a lot of our patients have issues with health literacy. I think a lot of Americans have trouble with health literacy. I think our patients are not unique in that sense, and so that's been a great partnership for us.